Hello, ma'am.
Hello, ma'am.
Yes,
Yes,
ma'am, please tell me.
yes.
So
Hello everyone. Good
I guess it's
evening.
for other than 21.
More practicals as of now. Okay. Vasudha, go ahead.
Yes. Thank you. Let's make sure that there are no more interruptions until unless extremely required. Today's topic is again process of counseling. Our objectives for today will be defining the counseling process, talking about the steps and stages of the counseling process, discussing key differences between the stage of the counseling, and also through talking about the components. We'll be talking about the steps involved in terminating a counseling process and explaining the important factors influencing the process of counseling. The process of counseling is an interpersonal process engaged in by the counselor and the client. It in and they do this to attempt to define or address any of their problems or that the client is facing, generally in a face-to-face interview. But nowadays there is more than just face-to-face interviews. We have these phone counselings, email counselings, message counselings and stuff like that. So there are different other processes in which counseling takes place, and the goal is a major part of this counseling process. It is where we finally want to be. So the goal in the counseling process is established by the client. The counselor is there to provide support and encouragement and any kind of assistance that the client needs in order to reach the specific goal. And during the counseling process, the client generally narrates his experiences or their problems, vulnerabilities, and definitely their goals. Then they talk about the fears, right? Before we come to fears, the counselor definitely helps the client in identifying these fears and apprehensions, or try to try to help them figure out what the fear is. So generally when we're talking about fears of a client, they're combined or they're categorized into three major categories: fear of abandonment, fear of rejection, and fear of not being enough. Now, apart from this, counseling process is typically used to bring out a positive change in the client's life. Uh, this person named Sajjad in the year 2017 stated that the process begins with exploring the challenges of a client and assisting them in resolving these developmental and situational difficulties. Counseling as a profession involves dedicated time set aside to explore any difficulties or stressful situations or emotionally upset situations that is faced by the client. Okay, it also includes helping the client see their situation and describe their feelings, and look at their feelings from a different point of view, potentially to facilitate change, right? They are trying to make the client look at their difficulties in different point of view in order to help them develop or facilitate change. Building a relationship based on trust and confidentiality, it is the most important part of the whole counseling process. Okay, the counseling process does not involve these few things that I'm going to discuss about. It is providing advices. We do not provide advice to any of our clients. We are not judgmental. Never should we be judgmental in a counseling process. We're not going to encourage the client to behave just like the counselor would in their own lives. We are not going to tell them how they have to be in their own lives based on how we are in our lives. Okay, we're not going to push the counselor's value sorry we're not going to push our values onto the client. We are never rubbing off our values onto the clients. Emotional attachment between the counselor and a client is a big no no. We have to be as disengaged or disattached to the whole counseling, the client, when they come in. The counseling process has been described as both an art and a science, helping to bring about change in thought, emotion, and behavior in the client, right? Next, we move on to the different stages of counseling. There are typically five stages of counseling. Before we go on to that, the counseling is different in both form and purpose based on each counselor, right? Most counseling theories are based upon these three aspects, that is, relationship building, problem assessment, and goal setting. The counseling process requires patience on both the part of the counselor as well as the client, which means it's a very collaborative process. The counselor does not fix the client, they're not there to fix the client. The work requires interaction and commitment from both the client and the counselor. Next, we move on to the first stage of the process of counseling, which is relationship building. Relationship building is where we and the clients are there to talk to each other in a way that sets up a healthy relationship. Okay, and the entire counseling process begins with this particular relationship building. The client is engaged in order to dig deep into their issues, and to directly in which sorry these issues are directly affecting the client. The first interview sets space to the rest of the sessions that are to come. The client reads any verbal and non-verbal cues that draws inference about about the counselor during the process. So they are judging us, they're testing us through these particular verbal and non-verbal cues that we have towards them. The counselor focuses on good listening skills and building a positive relationship, because these are important in the counseling process. A successful relationship between the counselor and client leads to a strong foundation for future dialogue. I remember Martin saying clearly that one of the counselor was talking to a counselee, one wrong question, and the counselee shut themselves off to the counselor, and there was no future dialogue. So that is a big no-no. We cannot ask questions or say something that makes the client shut themselves to us. Next is your second process, which is problem assessment.
Can
After
I
the
can I
count, sure.
so can I there is that
Martin, can we keep it to the end of the session, please?
okay okay
Because
okay okay okay
we
okay okay
have a little more to
I'll
go.
keep it right. I'll keep it right.
Thank you so much, Martin. No offense. So stage two is your problem assessment, where the client is talking about their problems, and here they have to develop. After developing a beneficial and a collaborative bond between the counselee and the client, the problem assessment begins. That is where they start talking about their counseling process, or sorry, the problems that are there in the client's life. Counselors listen and tactfully draw out information regarding the client situation on all fronts, as well as their expectations of counseling. So every client comes in with expectations that needs to be drawn out by the counselor very tactfully, in a way that the client doesn't feel that we are badgering them. Information is crucial in identifying triggers, timing, environmental factors, stress levels, and other contributing factors. So, all information must be drawn out very, very tactfully and very subtly in order to help the client. Then we move on to the third stage, which is goal setting. Effective counseling relies on setting appropriate and realistic goals. Building on previous stages, the goals must be identified and developed collaboratively with the client, committing to a set of steps leading to a particular outcome. Now, these certain steps that we're talking about are your SMART, right? They're supposed to be specific, measurable, achievable, realistic, and timely. Without these SMART goals, there is nothing that we can do about helping the client go towards their goals. Next is your stage four, which is counseling interventions. This stage varies depending on the counselor and the type of theory that they're familiar with. Okay, a behavioral approach may suggest engaging in activities and designs to help the client alter their behavior. In comparison, a person centered approach seeks to engage the client in self actualizing tendencies. Okay, here you're supposed to, here you're trying to go through different ways in intervention, right? So each type or theory that you're taking up, has a different way of intervention. Next, we go on to stage 5, which is evolution, termination, or referral. Termination may not seem like a stage, but it is an art, right? You cannot just abruptly close a counseling session because that will lead to things like anger, aggression, sadness, anxiety, and other very strong emotions, which is a whole different counseling session altogether. Drawing counseling to a close must be planned well in advance to make sure that there's a positive conclusion at the end of it, right? Again, as I said, we need to avoid anything such as anger, aggression, sadness, anxiety on the part of the client while we are terminating your counseling process. The part of counseling is to reach A part of counseling is to reach an early agreement on how the therapy will end and what success will look like. This may lead to a referral if required. See, at the end of the counseling process, in case something else is required to help the client reach the goal, it is referred by the counselor to wherever they have to go to. That is your stages of counseling. Let's move on to different steps. So there are 7 basic steps that are there in the counseling process, 4 which are required from the side of the client and 3 from the side of the counselor. The client must be willing, motivated, committed, and must have faith in the counselor and the counseling process. From the counselor, what is expected is unconditional positive regard, empathy, and congruency. Now, let's look at each one specifically. Willingness is what it means, right? Being willing to seek and attend counseling in is a crucial step for any individual. It involves the recognition that they need to make a change and require help to do so. Taking the next action often involves overcoming the anxiety of moving out of their comfort zone and engaging in new thinking patterns and behaviors. This is what willingness is. Motivation is the willingness to make a change, and engage in them involves maintaining and sustaining and motivation, right? So without it, the counseling process will falter, and the real work, that is when the real work begins. Sorry, it falters when the real work begins. We move on to commitment. The client must be committed, he must be willing to do it, he must be willing to put in the time and the efforts to do it. That is what commitment means. The client may be willing and motivated, but change will not happen without continued patience and commitment. Commitment may be a series of repeating decisions to persist and move forward. We move on to faith. Now, counseling is unlikely to succeed unless the client has faith in themselves, the counselor, and the entire process of counseling, as I said before. Taking the step to begin and continue with counseling requires belief that it can be successful. They should believe in themselves, the counselor, and the process in order for the entire process of counseling to be successful. Unconditional positive regard. Now we are moving on to the place where things are needed from the counselor. So, throughout
Sudha,
the,
just a second,
yes,
just a
sure.
second. From the counselee's point of view, the previous points that you have talked about. So we say
Yes.
that willingness. A lot of times, a parent would get a child and actually tell them a lie that I'm taking you to this auntie who will talk to you and things like that. So obviously, the client for us is the child. It's echoing, right? Vasudha, is it okay?
No, 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 it's fine.
Okay. So I was saying that in that case, it's a very reluctant counselee, right? The child doesn't want to be counseled. He's been told a lie. So that willingness is very important. So first, as a step, towards building that relationship, you have to actually build that trust with the counselee. Similarly, a husband may get a wife. Those are the things. So willingness is very, very important. That if a person wants to work on himself or herself, that person should want. The horse cannot be pushed to water. The horse needs to drink. I mean, it's like bringing the horse to drink water. The horse has to be willing. So that is the most important part of counseling. This is from the counselee's point of view. Vasudha, next slide. Motivation again, yeah, see, lot of times a counselee may just want to come and rant and crib and talk about their problems in life. You will find as a counseling session it's not moving ahead at all, because sometimes they just probably use it as an emotional dump yard where they'll just come and say, oh, this is a problem, this is a problem I'm having in life. That victim attitude, right? If there is no willingness to change anything, then again that counseling session is not moving ahead at all. So motivation from the counselee is very important. Masuda, move on. Yeah, and of course the commitment. It has to. You cannot dilly dally. There are lots of counselees who will come for one session and then they won't turn up for the next sessions. And then after 6 months they'll call up again and say, "Oh my God, something happened to me. Can I come now?" So you can give them one or two chance, but if you see a pattern there that there is no commitment from their side to regularly come and work on themselves, then you have to handle it differently. So this is very important from the counselee or the client's point of view. Moving on to the counselor, right? Oh, faith,
No,
yeah,
there's
faith.
one.
This
Yeah.
is also from the counselee. It is very important that there is a very trustworthy relationship that is developed. If the person, the counselee or the client feels that, oh God, all this is useless, yeah, what's the point of going? Then obviously the whole thing will not. So again, having that trust and faith in the counselor is very important. Right, Vasudha. We can move on to the counselor now.
So, what is required from the counselor is unconditional positive regard. Without this unconditional positive regard, there is no future to this counseling session, right? There's no future to the counseling process. Through acceptance and non judgmental behavior, the therapist makes space for the needs of the client and treats them with dignity. And what unconditional positive regard means is it is an attitude of caring, acceptance, and praising the others to express towards an individual. Sorry, it is an attitude of caring, acceptance, and praising that others express towards an individual, irrespective of his or her behavior, without without regard to the other's personal standards. Unconditional positive regard is considered conducive to the individual's self-awareness, self-worth, and personality growth. So it is important,
Yeah,
right? No matter,
Vasudha.
yeah. Go ahead, go ahead,
Yeah,
go ahead,
yeah.
Seema.
We'll go one by one. I think that will be better. You have
Sure.
anything else to add? Otherwise, I can.
No, you can go ahead.
Right, right. This is a very, very important part. This is not only actually as a counselor. See, all these, when we talk about this, the skills or the attitude of a counselor, unconditional positive regard is even as an individual, how do you respect and regard the other person in front of you? And especially so in a counseling scenario, because what happens is a lot of times you feel, oh God, I need to fix this person's problem. If you come with that attitude, if you are like, okay, somebody is coming and telling you that I'm gay, right? Suddenly you judge them and you're like, oh God, no, now this is not, I cannot handle this, or this is not a person, to be respected, whatever it is. Even if it's a rapist sitting in front of you, or any person who's claiming that, okay, I'm having an extramarital affair, whatever it is, you are not going to judge the person. And it's not that just because you're a counselor that you're not doing. As a person also, the idea is that we as counselors need to be absolutely not judging anybody and accepting them for who they are, whoever it could be. It could be, anybody who has done a crime, right up to anybody who is in a miserable state. You're not going to judge. You're going to be very open and flexible. So it has got to do a lot. I mean, you need to really work very hard to develop this unconditional positive regard for any person. Even if it's a kid who's 5 year old, you cannot say, oh, this is just a kid, and oh, I think this problem is not important enough. For that particular kid, it's a very important problem. So the thing is that
True.
for every client that comes to you, you have unconditional respect and regard.
Sorry,
Give them
sorry.
that. It's a very equal relationship between the counselor and the counselee. Never, I think we should never think that we are at a higher level than the counselee. So that is the meaning of this word. It's a very, very important thing. I mean, don't just take it lightly as it's okay, you have to regard everybody and respect. It's a very important trait of a counselor. So this is, a very important term that you should remember: unconditional positive regard. Rogerian really has chapters and chapters written on this. Okay, moving on.
So the next thing that is required is empathy. So without empathy, we cannot, hold a relationship or make that relationship happen, the bonding happen, right? So empathy is understanding a person from his or her frame of reference rather than one's own reference, right? I cannot think about Seema's point of view just by thinking like myself. I'll have to think like Seema to understand what she's going through, or it is vicariously experiencing that person's feelings, perceptions, and thoughts. That is what empathy is. I think this is straightforward. Seema, can we go ahead?
No, yeah, this is also a very,
Okay,
very
sure.
deep, deep topic by
Of
itself.
course it is.
Most
Empathy,
important also, I guess. Huh?
very, very
Yeah, it
important
is.
and
It
very
is.
difficult also.
Yeah.
Vasudha, can you just turn off the echo? It's echoing. Okay, so empathy
Sure.
is, in a simple terms, putting yourself in the other person's shoes, and this is also something that it's actually entering that little world of your counselee or the client, and trying to observe life and thoughts and feelings from that client's point of view, right? That perception is very difficult actually. So it's again, the whole thing of not judging the person, trying to understand, okay, where this person is coming from, what. See, it's not important to feel the feeling, right? You're not, suppose a client is feeling very sad, is feeling very neglected, feeling lonely. You don't have to feel that feeling. I don't have to start feeling lonely. I don't have to, because that will make the two of us. The thing is that how do I understand the client's feeling? How do I understand what the client is going through? How do I enter that world and start observing from that client's point of view? So that is empathy. It's again a skill to be practiced, right? And again, not to be confused with sympathy. A lot of us think being empathetic is actually being sympathetic. If the client is feeling sad, you also feel sad. That's not empathy at all. Empathy is actually entering the little world of the client and trying to see from the client's perception, what is his perception of life or of that situation. So again, a very, very deep topic by itself. Maybe through demo sessions and all, we can kind of highlight these. So please remember these terms: unconditional positive regard, empathy. These are very, very heavy terms which
No,
have to be
basically,
practiced.
empathy is understanding why he did what he did.
Is
Right?
that Sunita?
Understand? Yeah.
How many of you are there?
Huh?
There is 3-4 echoes.
Praharsh,
Right,
can
right.
we keep that aside, please, now for now?
Okay, listen, actually, what Sunita said is a lot, it's very important. What she's saying is that it's, you don't have to see what the person, you have to see the why behind the what. Why is the person behaving in a certain way? Why is the person feeling the way he's feeling? Why? So it's the why behind the, normally we focus on the what. Oh, the person is very angry, the person is very sad. Why is he angry? Why is he responding? So empathy is actually answering the why behind the way the person is behaving. We'll keep discussing this over the next session.
Sunita gave a correct example. That means sympathy is primarily you understand what the client is going through. However, empathy means you feel what is he going through.
Martin, sympathy is our emotion, right? I am feeling sympathetic towards him. That is mine. But for counseling, we don't need mine. We need only what the counselee is doing, right? So for understanding what the counselee did for what reason from his perspective is empathy. That's all. And just understand sympathy is my feeling.
No, empathy can be yours also.
No, empathy is understanding why he did what he did from his perspective. Everything is theirs. We are just understanding it.
You're right. Sympathy, primarily difference between both is that sympathy is that, let's say, a client, you sympathize with him as in you understand what is he going through. But empathy
You
means
feel bad for
actually,
your client.
yeah,
You feel bad for your client. That
yeah,
is
bad,
sympathy.
sad, whatever. But empathy means you feel that person what is he going through. That is empathy.
Yeah.
You understand what the person is going through. Empathy
You
is
don't
for
want to
understanding. You're not
You
feeling
don't
like
want to feel that sadness.
yeah. If a beggar comes begging, again it's empathy. If a beggar comes to your thing, what do you feel? You feel sad. That is sympathy. You're not
I,
empathizing. You don't understand. So it is sympathy. Anyway, we will. I think proceed, this is a very important topic. That's why we were saying. I think we will have more of it when we go to Rogerian and all of that. So right now, I think it's very like we said. One or two pointers are the why behind the person's behavior, and two is that trying to understand what the other person is going through from his perception, right? Not feeling that, because if you're feeling sad or if you're feeling lonely yourself and all of that, then that's not empathy, right? So I think we can move on and we'll come back to these topics. These are very
Sima, you want an example?
okay, go ahead.
See, sympathy is when your mother-in-law's leg is fractured. Empathy is when your mother's leg is fractured. You have not heard this before.
Okay, not sure if these are the right examples, but let's move on.
Yes, please. So congruence. Congruence is the words and the feelings and the actions of the counselor that embodies consistency, right? So it should be consistent with what the client is going through. In general, congruence is agreement, harmony, and conformity towards the client. Seema, is that right?
Oh yeah, and it's again, I think one of the most important, skills or attitude to develop. In fact, Sunita and I were discussing that this is our New Year's resolution.
New Year's
So
resolution is congruence.
correct. Congruence. Congruence means what you're thinking, what you're saying, and what your action is, right? Your thought, your feeling, your behavior. It's all in sync, or rather, what you're thinking, what you're saying, and how you are behaving, right? So remember, this congruence is absolutely in sync. Everything should be in sync. A lot of times we are a lot into people pleasing and all of that. We are thinking something, but we end up saying something and we accordingly act in a certain way. Congruence is all these three things in sync, absolute harmony, right? It is one of the best, it is one of the most important aspects of counseling as a counselor and as a human being, as a person. If you're congruent, that is what. So this is a very, very important skill and an attitude to develop, and very, very few people have this, right?
Basically, congruence is the opposite of hypocrisy. Right? Congruence is the opposite of hypocrisy. So, you what you think, what you say, and what you do, everything should be on the same line. If it is something else, if there is a change, that means you're not congruent. Why you need to be congruent is the point is one is because the counselor is also watching you, right? The counselor is also judging you. The counselor is also seeing what you are made of. So when you are saying something but doing something else, or behaving in a different way, the counselor loses the respect for
It
you.
may be
What is
something
the
like
reason the counselor will come to you?
it
They
may be
believe
something
that they can
like
do something. They
practice
can't
what
trust
you
you.
preach.
Again, it translates into respect and factor. So if they can't trust you, then again there is the question of how will they open up and tell about their lives. So it is a very integral part and most basic as well as most difficult part to be congruent, because all of us but issues and the outside, originally we might be so easily we'll be trying to project a persona of ourselves, but once we start seeing the client week after week after week, we'll also lose that different system that we have, and without our knowledge we will start talking things and doing things which originally belongs to us on the inside. So then the client will very clearly see the difference, that in the beginning she was talking like this, now she's talking like this. The client can see it very clearly. He will not realize it. So from the beginning, it is important for us to always be on the same line. Then it is okay. We are human beings. We don't need to project ourselves like a sage or a saint. Okay, and then later on falter from it and start looking like somebody else. So from the beginning, you have to be congruent with who you are and project that image only to the client.
నాన్న ఇది కాకలా వస్తుంది.
Right. Please remember these three terms. These are very important. Congruence, unconditional positive regard, and empathy. Right. We'll keep going, revisiting these words again and again. So the on.
Yeah. Sorry, my laptop got stuck for a minute. Okay, so now we move on to the structure of counseling, the structure of the process of counseling. Okay, there is a general process that many counselors tend to follow. First, first and foremost is general personnel information like their name, their address, their phone number, emergency contact, where are they working, what is their age, and things like that that they take up, right? After which they start identification of the core issue, which is followed by case formulation. That is where the actual case starts to develop. Then, after the case is developed and your problem assessment has happened, then we move on to goal setting. That is where the actual thing happens, where you're moving towards the successful part of your uh, counseling process. Implementation of interventions in case the goal that is to be reached has some obstacle before it. These interventions are used in order to help the client move on. Evaluation of interventions to see how successful that intervention is. And at the end, we're talking about closure. Closure is when at the complete end of your counseling process. That is when you're about to terminate your counseling process. Sorry.
Right. The stages that you spoke of, Vasudha, is uh,
Yes,
can
yes,
you
sorry,
just
sorry, sorry.
switch
Yeah,
off the echo?
yeah, yeah.
Yeah, so this is something, if you recall, we did it in our MSc, right? The mental status examination. This is what how we went about. Of course, personal information, again, if you're recording it, usually you just use initials and all of that, the basic structure. But actually, this is not what is usually followed in different types of therapies. For example, person centric doesn't follow it in this format. Generally, this is the counseling process, but it doesn't happen that after all of this intervention happens. So it's a different thing in person centric, it's a different thing in psychoanalytical theory. But the proper clinical way, when a psychologist sits in a probably a hospital setup or a clinical setup, and a client comes, this is generally how it is followed there. But this doesn't mean that this is followed in different types of therapies. But to start with, this is a good start. This is like what we did in our internship. So yeah, you can.
Yeah. So moving on, based on the initial interview, the counselor. Sorry. Uh, yeah. Let me just give me a second. Yeah, based on the initial interview, the counselor and the client together decide the future the following three options that they have. First one is if there is no counseling required in the future. That means uh, they've come to the end of their session, or okay, not the end, after the first session that they have, after the first interview that they have, to see if the problem has been solved, and if they need no further counseling, that is when this is decided. If further appointments are required and the counselor feels so, they try to tell this to the client and get the client on board with further appointments. And in case of alternative services, needing of alternative services, suppose the counselor or the therapist feels that this person needs a psychiatric consultation or they need speech therapy, they'll send them to specialized alternative services where they can be helped. Seema?
Right. It's a very general guideline. May again change from different, different types of what is it called psychological I mean your person centric and all of that, different therapies. It differs from therapy to therapy, but this is again the general guideline normally in a clinical setup. This is how it is followed.
Next, we move on to how the counselor works on the basis of one or more of many theories, right? If it is like an integrated therapy, then they use one or more of these multiple therapies that we have. However, during the entire treatment period, there are few variables that we need to keep in mind for the success of our counseling process. So the variables that are there are the severity of the problem, the motivation of the client, the type of problem that we have, the age of client, the focus on the problem, how focused we are on the problem, and the level of healing that is happening. So depends on the stage at which the client is. If the wound is still raw, then it takes a different time to heal than if it is he's already been trying to heal it on his own. Or not, I'm not talking about the self medication and the maladaptive behavior when he's going through. I'm talking about the proper ways of healing, like meditation, mindfulness, and other techniques that we will see in the future. Seema?
Right, right. So, like we saw, no difference between counseling and psychotherapies and those things. So, again, depending on the nature of the problem, the intensity of, if it's a very sort of a current problem, then maybe a few sessions of counseling would be enough. But if it is a very deep-rooted problem, some sort of a core level distortion, some cognitive distortion, then you end
అక్కడ
up
ఉంది.
using maybe a CBT or something. So, net, what it means is that as counselors we need to probably keep upskilling ourselves, learning different types of therapies, because it can change from client to client. So you don't use the same for everybody. For some people it may not work. So yeah, again, these are very general guidelines, that these are the things to be kept in mind when you choose one type of theory or therapy over the other.
We move on to the process or the procedure of the counseling process itself. So first things first, we establish a very safe and trusting environment for the client. We help the person to put their concerns into words. So in case for example, a mother comes in, she has been taking care of her kids, her parents-in-laws, her husband, and everyone. She does not have much of an education, or she does not know how to express herself. We give her the feelings wheel, and then we'll be like, oh, okay, you can choose from this particular wheel what you're actually feeling. So when you're talking about bad, sad, mad, there are subcategories under it which we are going to talk about, right? That is where we can help the client put their feelings into words. Next, we use things like active listening. We try to find out the client's agenda. We use things like paraphrasing. We use techniques such as paraphrasing, summarizing, reflection, and interpretation in order to get a proper understanding of what the client's agenda is. We're going to focus on what they're feeling and not the event. We cannot change the event, but we can definitely change the outcome of the event, right? In due course of time, we can definitely change how they're feeling about the event. Then we're going to transform the problem statement into our goal statements. So if the client is coming with anxiety in a public situation, we're going to change the problem statement, which is anxiety in a public area, to feeling comfortable in public places. That is our goal statement. We're going to let them explore possible approaches to the goal, and we're going to help them find these possible approaches. Counselors help people choose the best path to reach their goal. So if there is any hurdle in between their from their current place to their goal area, we're going to try to help them pave a path to reach their goal, right? And we're going to make a contract to fulfill the plan and to take the next step. Here, contract doesn't mean literally pen and paper and stuff like that. It is more about a commitment and motivation to reach that particular goal. We're going to summarize what has occurred and obtain any clarifications or verifications that we need in order to help the client reach their goal. Next, we get feedback and confirmation from the client. Seema?
Right, Vasudha. So again, these are general guidelines for a regular sort of a counseling session. Again, this changes from therapy to therapy. This is more structured, let's say in a CBT, where you say, okay, first of all, a very safe and trusting environment. That is a rule number one for any climate, a counseling climate to be developed. And yeah, the person helping the person to put in words. So you use those micro skills. The person will come and tell you everything that is happening, that is concerning. Now the thing is for you as a counselor to pick and choose, or to actually summarize or paraphrase the core issue that the person, the client, could be facing. So for that, active listening is very important. All these are micro skills that we were talking about earlier. Paraphrasing, that is talking about the situation along with the emotions, and summarizing. Okay, so the person will tell you something for 30 minutes and you're like, okay, so what you mean to say is, or what I hear you say is something like that. So you will summarize it, because the person will be probably repeating a lot of stuff or talking about a lot of things. Some of it may not be really relevant, some of it may actually have a hidden meaning behind it. So you have to summarize and check with the client, am I getting it right? I mean, this is what I understood of what you just, is this right? Do you really feel like this? That kind of a thing. So you have to keep asking those open-ended questions and summarizing it from time to time and helping them to reflect and interpret. Have you got it correct? Right? All that you on the back and forth thing. And this is a very important point, focusing on the feeling and not the event. See, the bio data is not important. The events are not important. Last summer I went to Delhi and I fell in love with somebody and this, that, something is the person is telling you. Right? Now you have to focus on the feeling. As a counselor, don't start asking very probing questions like, oh, when was it? When did you go to Delhi? Or did you go in May or June? Actually, all those events, the bio data and the data actually is not important in a counseling session. What is important is how the person is feeling. So always you keep on going back to the feeling of a person in any counseling session. And yeah, the other steps of problem statement. Obviously, the person comes with a problem, and the idea is to help the person to deal with the problem. So you do goal setting and all of that. But in usual, goal setting happens only after the person has completely. There's a catharsis that has happened. The person has went out. You have to first identify the core things that the person or the client needs to work on. So and then you set goals. So it's a step-by-step process. And yeah, the contract, like Masuda rightly said, it's not like a written contract. It's an understanding. Okay, so let's first work on this, right? Let me help, or whatever. Let us together work on this issue. Can you? So you identify the top issues and then work on that. So that is an understanding. That this is how we go about it. And yeah, the summarizing, getting feedback, confirmation. Again, a more routine sort of a process. But yeah, you constantly do this. So you are going on asking the questions, the open-ended questions, and are you getting the person right? Is the person moving forward? Is the whole process as we go on. We keep on checking with the client and going towards a general direction, getting the client out of a particular issue that the client is facing. Right, Vasudha?
So, so there are certain rules that must be followed during the counseling process. It is to listen without interruptions. It is to provide the client safe space to explore their thoughts, feelings, and behaviors, and help the client understand their own feelings. Because many times they're in a state of confusion, dilemma, and they're there. They do not know what to think. That is where we try to make sense of what they're feeling. The process of counseling develops okay the process of counseling develops in definable stages with recognizable transitions. That means there are milestones, and when we hit the milestones, we ourselves get to know that we're at this particular stage in the counseling process. So it's very definable, it is very recognizable. Seema?
Yeah, right. So this is self-explanatory. You have to listen, active listening. Again, when you say you have to listen to a client when the client is speaking, again, the focus is not on the data, or of course, you have to be very attentive, but you have to keep listening to the feeling of the client. So that is the crux of the whole counseling session. What is the client feeling? That is constantly, that should be something that you should be also reflecting it back to the client, paraphrasing and summarizing the feelings of the client, and definitely providing a very very safe climate. Counseling climate has to be very, the person should feel that, yeah, I can trust this person. This person will not go and talk about me to somebody else. So the person, especially when it comes to a child and a mother, and the child feels, yeah, feels very safe, that I can tell this lady about my problems. She will not go and tell my class teacher, or she will not go and tell my parent. So that is very important to, so that the person can be very genuinely discuss their thoughts, feeling and behavior, without feeling that they are being judged, or without feeling that, okay, this will be told to so and so, and told, my husband will come to know about it, or my teacher will come to know about it, and that kind of a thing. The most important thing is helping the client to understand their feelings. Let us
ನಾನು
not be
ಬೈತಲ್ಲ.
under the assumption that the client is very clear about their problem and their feelings. Lot of time the client will come and say, I was mad when my boss shouted at me in front of everybody else. What the hell does he think of himself? I hate it, I'm going to resign. See, that is, those are the kind of feelings he's talking about. Actually, if you look at the surface level feelings out of this, it is anger and that kind of a thing. But actually, as a sensitive counselor, you can figure out that there is a deeper feeling that the client is going through. The client is going through embarrassment, hurt, humiliation, right? So although the client is telling you that he is angry, let us not just assume that that's only anger. So you check the feeling back with the counselor or the counselee or the client, saying that must have probably made you feel very hurt. Was it humiliating for you? And immediately the client will say, absolutely, yeah, what does he think of himself? Just shouting at me in front of 10 people, I was very embarrassed, I was very humiliated. And that is when the client feels, okay, this counselor of mine understands me, because he's not told you he's hurt and humiliated, but you figure that out. So as a counselor, you have to be very sensitive to the counselee's or the client's feelings all the time. This is a very important part of counseling. Yeah, Vasudha.
So the three major stages in this process are, and this is just a recap, it is to develop a relationship, it is working on a relationship, and terminating a relationship. So let's go into the factors that actually influence the counseling process. So the first and foremost thing is structure. What is structure? I mean, if you look at a building, its foundation and the bones, like the pillars and all that you lift up from the ground, is what is going to give your entire building a structure, right? So technically, structure is a joint understanding between the counselor and the client regarding the characteristics, conditions, procedures, and the parameters of counseling. It helps in clarifying the counselor and client relationship and gives it a certain direction, right? It is how you're going to go ahead. So even if in a building, right, if you place a pillar about a feet and a half away from where it is supposed to be, the entire place and the entire, sorry about that, Snuffy, chup, the entire way the entire building will look is going to be very disturbed and very odd, right? So a structure, it is where it is supposed to be. It, that is where it gives it direction and the neatness of a building. It protects the rights, roles, and obligations of both the counselor and the client to ensure a successful counseling process. Seema?
Yeah, I think it's quite self-explanatory. Yeah, you can move
So
on,
I'll
Vasudha.
move on. I'll move on. So next is your setting. You can't just have it randomly under a tree, right? Your entire setting, you cannot sit and talk to your counselor in under a tree. That is very, what do you call it, unprofessional. And you cannot actually have a safe space for them to explore, because they're always going to be in a fear of who's listening to me. Oh my God, is my father listening to me? Is my husband listening to me? Are my children listening to me? No, we can't do that. So a generally, it works in a room. You have a room where your counseling setup takes place, right? The professional generally works in a place that provides privacy, confidentiality, quiet, and comfort. When working with a client, a counselor must want to send a message that he or she is listening to your client. The room, so there are some specifics that must be kept in mind. That is, the room should be comfortable with and attractive with soft lighting, some very muted colors. You can't go for bright reds, you can't go for bright oranges. No, you'll have to have very mellow tones. You can't have too cold or too warm a color. There must be absence of clutter, so the entire room must be so clean, and clean in the sense it shouldn't have anything that is unnecessary, that is creating a noise, that is screaming out at the client saying, oh, I'm very, fancy, kind of a thing. It is supposed to be very mellow, and it's supposed to be harmonious, and it has to have very comfortable furniture, because when a client is uncomfortable, they cannot really focus on what they're trying to tell you, or you cannot focus on what the client is trying to tell you, right?
Yeah, again, very self-explanatory. But yeah, these things you should really keep in mind that, people outside should not be able to listen. All this is really, the client becomes very conscious of all these things. Oh, can I be heard outside? Do people watch me when I'm entering this particular? So all those things you have to make sure that the client is very comfortable. And the setting is such, it should be a very, it should give that warmth, and that whole thing should talk of confidentiality, that the person should feel that, yeah, this is a safe space, there's a right kind of distance. Maybe, there are a lot of things that you have to keep in mind. So yeah, we'll again talk about this a little later, but yeah, these are the broad level settings.
uh, So basically, when you're trying to keep contact, or when you're trying to communicate with your client, there are certain techniques that you can follow. So solar is one of those techniques that must be kept in mind when you're facing your client. So you're supposed to look squarely at them. You can't lean over to another side. You can't turn over to another side, sit cross-legged or cross-bodied when your client is sitting right in front of you. You're supposed to face directly towards them. That means you're supposed to look at them squarely. You're supposed to have an open posture. You can't have your arms crossed across your chest, because that means you're not trying to listen. You're supposed to have an open posture where the client perceives that you're actually listening to them. Not perceives, he realizes that you're listening to them. Leaning towards the client shows that you're interested in the conversation. Again, these all come under body language, where it is very important to maintain stuff like this. Leaning backwards will be like, okay, I'm bored of this conversation, can we move on? It indicates something like that. Eye contact, if you cannot keep eye contact, again, continuous eye contact is creepy. No, don't keep a continuous eye contact. You have to maintain proper and optimum eye contact in order to make sure that the client knows that you're listening to them and you're very attentive and focused on them. But it shouldn't cross that creepy, that thin blue line, which is creepy, right? And last and finally, you cannot tense up. You cannot make it look like as though, okay, fine, I'm agitated enough to make sure that they listen. So you can't put too much effort into trying to make sure that you look like you're listening to them. You're supposed to relax and let your instincts take over when it comes to listening to your client. Seema?
Right, right. I think again they're very self-explanatory. We can move
Self-explanatory.
on.
And client
Can I
qualities, there are
add?
certain.
Can I add something on this?
Sure, sure, sure.
So you said like eye contact is very important, and you can't keep continuously gazing at the client.
Exactly.
So what happens is, if you may get intimidated, you may get, he may get intimidated or she may get intimidated. But my instructor at my psych research says, you eye contact, you can make it in between. If you draw a triangle between your eyes, both the eyes, and the bridge of the nose, and in the center, just above the eyebrow, you concentrate on that. It's a body language technique anyway. So you concentrate on that point, the person will feel that you're looking into the eye, yet you're actually not looking into the eye.
Okay. Uh, this again, we'll have to look into it, Martin, because not sure exactly. Seema and Sunita might have to tell, but I do agree it is a very nice technique that we can follow. But again,
Right,
you
right,
can't
right.
keep
I think that,
constantly
yeah, yeah,
staring
that
there.
could be a technique. That could be a technique, but at the same time, I mean, if you're comfortable looking at the client and giving those empathetic nods and looking, I don't think these are very these are things to be conscious about that much. But yeah, Martin, what you said probably makes sense for people who don't have the habit of looking at people, people and their, you
No,
know.
actually, I agree. See, I find it very difficult to maintain a eye contact eye to eye. See, that's not what we are looking for. All eye contact means is that the client should see that you're looking at them. It
Exactly.
doesn't necessarily have to be just the eyes. The face is
Bang
good.
on.
Yes.
Bang on.
Yes. So eye contact is where you're looking at the client. It is not exactly into the eyes. No, aankhon mein aankhein dal ke dekho. No, it is basically trying to make sure that they know that you're attentive towards them. Again, making sure that you're too attentive. That is, you're continuously looking at them makes them feel a little uncomfortable. That is where you're crossing the line into creepy. So let's move on. There are certain client qualities. So we were talking about the counselor qualities till now. Certain things that we need to make sure towards the client. But there are certain things that we want from the client in order to have a very successful counseling session. So the development of relationship happens based on the first impression. The clients come in all shapes and sizes, personalities, characteristics, and degrees of attractiveness. So certain people like Schofield and Allen mentioned that their criteria for the success of the the success of the client or the candidate. So I don't think these apply these days, but this was mentioned in the textbook, so I am going to mention this here. So the most successful candidates are said to be Yavis. Okay, that is young, attractive, verbal, intelligent, and successful. And these are again by Schofield and Allen decades ago. That is in 1964 and 1977. They believed that less successful clients come out as are seen as hound, which are homely, old, unintelligent, non-verbal, and disadvantaged, or dud, that is dud, that is dumb, unintelligent, and disadvantaged. But I personally do not believe this is true. Seema?
I agree with you, Vasudha, because these are like 1964 and 19. See, it
Ex-
is just contradictory to the
exactly.
unconditional positive regard, right? So
Exactly.
it doesn't matter
Exactly.
what shape and size the person comes in. So this is absolutely not what is followed today. So no matter who's
Yes.
sitting in front of you, it's the same, quality of your counseling session. So, but
Imagine
anyway, it's in
homely,
the textbook, so we've gone through it. But one thing
Yes.
is there, okay, let me
homely.
just add. I'll just add, Vasudha, yeah. So, but what happens is, having said that, a lot of times we, as initial, brand new counselors, sometimes we may get intimidated if there's a very good looking person sitting in front of you, or there is a person who says, I work for NASA or ISRO or,
Yes. Yes.
something like that,
Yes. I agree.
or
I
he says,
agree.
I'm an IITN or I am, suddenly the person is coming and starts talking about something very fancy. Automobile engineers and all that are also here, na? Martin and I don't know, Vikram and all. So a lot of times what happens is that people counseling, suppose you are
Intimidated.
just a graduate as a counselor, you feel, oh my God, how will I deal with this guy? This guy is probably a minister or some, aeronautical engineer or some ISRO person. How will I, deal with this? Or somebody from a very affluent background or a
Background,
corporate,
yeah.
this thing. So those things actually might make you feel a little hesitant. But again, as a counselor, that is nothing to be worried about, because all you end up doing is, as a counselor, to just focus on the feelings. So end of the day, the fact that they have come to you is that they need emotional support and help. So yeah,
True,
that's all I have to
completely
say about
agree.
this slide.
But in the beginning, we are still human. To err is human. Here, we just need to make sure that we do not err as much. Seema, is that correct?
Yeah, absolutely. Absolutely. I
Uh,
think we need to be very
so,
congruent and accept that, okay, I'm intimidated by this person.
yes, yes, yes,
Right.
yes.
It
That is
also
right.
shows a lot on your own self esteem. So, again, that's something you need to work on internally as a counselor.
Of
All
course,
right,
of
moving
course,
on.
of course.
It's easy to
So,
spot also.
yeah, True. Okay, let's move on. So the counselor qualities. So we spoke about client qualities. We did previously speak about the factors that are required or the characteristics that are required from a counselor. But there are certain qualities that are a must and should when we're going into the counseling field, right? We have there and there are five such categories or characteristics that every counselor must possess. It is like a must and should. First of all, it is self awareness. We must be self aware about how we feel, how we look, how we are presenting ourselves, and that must be important. Second is honesty. So, when we're talking to the client, we cannot have a two faced approach to it, right? We cannot give them a double meaning signal, not double meaning. We cannot give them a two-edged sword saying, okay, we are going to tell you this, but honestly, I wouldn't follow it. You shouldn't be able to think like that. We have to be extremely congruent. We have to be able to communicate properly. Again, there is a difference between a counselor's communication and a salesman communication, right? Doesn't We have more ethics compared to a salesman or a politician, and stuff and people like that. And extremely important is knowledge. You cannot get into the counseling field if you do not have knowledge about certain things. You need to be able to be knowledgeable about many aspects of life, be it medical, be it social, be it political, be it anything, right, Seema?
No, not, I don't completely agree with the knowledge part. You should be knowledgeable about the therapy that you're using, right?
Okay, yeah.
Obviously, as a human, it's not possible for you to be knowledgeable about politics, about
Everything.
everything else. In fact, you don't need to know. Again, like I said, an aeronautical engineer, when he comes and they start talking about how somebody has launched, or somebody from ISRO launching, your satellite to the moon, you don't have to be intimidated. You don't have to be knowledgeable about that. Oh God, this counseling, how will I now deal with him? He's talking about all these high funda scientific stuff. Knowledge here means how knowledgeable are you as a counselor? How confident are you with your skills of counseling? Right? So here, again, self-awareness is not so much about the looks or something. It's about how much I know myself, how much I know are my strengths and weaknesses. So that's why you have to constantly work on self. That's very important. And the best indicator is if in a counseling session you're getting impacted, right? You're getting affected by what the counselee is getting affected,
Transference.
and there's a transference, or rather counter
Counter
transference happening,
transference.
then that is something to be kept in mind. There's a check, so you need to go back and work on yourself. And congruence and honesty and all, we all know, absolutely important. And I don't even know why the textbook is talking about a comparison between the communication skills of a salesman and a
No,
counselor.
it did mention quite a number of times. That is why I came up with those. So,
I know. I think it's
yeah.
totally ridiculous. It's just some shoddy cut copy job from somewhere.
There is a one side of it, Seema. See, again, it's not a one-time job, right? It's an ongoing relationship. It can run for months. And when you're counseling someone for months, it's good to know what you're actually talking about, right? Then the person also will, grow in relationship with you. That okay, they are also understanding the world. I know how to explain my every single day-to-day words in
So
long
basic
sentences, right?
information, right? So
Yeah,
basic
so you can
The
information
do just
about
a
that.
workflow,
knowledge
right?
part.
Yeah,
So if someone is
yeah. I
coming and
think
I'm
yeah.
talking about my life, my software life, I have a release today. If they know what a release and it's associated with stress and other things, so it definitely the bonding is faster and you're not losing anything, right? The counselor can just Google couple of
Okay.
hours and they can learn a lot about the
Yeah, yeah.
profession. They know how to be new in the
Absolutely.
profession.
I
Yeah,
have
yeah,
a
yeah.
live example when I was like interviewing a graduate who had done from Welling, Dehradun for the interview. So uh, before the interview, I have to go through about what all he's done. So my instructor asked me, okay, tell me about this, tell me about this, tell me about this. Unfortunately, I didn't know anything about that. Then he said, that means you're doing a disservice to that person who's coming for his career option to you, and you don't even know what he's doing. So it
Exactly.
was
I
very
agree.
profound effect on me, as in to say that imagine how important for him to be part of, let's say, RIMC or something like that. So if I don't know about it, you don't need to know Bernoulli's theorem, you don't need to know any of the ramjets engines. But a little bit is helps a lot. Helps a lot.
True, true,
And
true.
you
Helps a
Because Martin.
lot. It's echoing so much.
Sorry, sorry,
Yeah.
sorry.
No, I do understand. Martin and Prahash both, you're absolutely right. There is absolutely no harm going and researching and Googling. And if it is about law, if it is about finance, if it's about anything else, science, the thing is also you can be very honest. You don't have to pretend that you know everything, or you can actually just ask the client, what do you exactly mean when you say something like that? You can actually, the client himself will tell you, and then of course you can go back and Google and learn more about it. There's nothing. But here, you don't need to know everything. You don't need to, you don't have to stop or feel intimidated in a counseling session if you don't know the profession of that person or what the person is practicing. It's perfectly all right to not know, because here the focus is not on the technicalities of what the person is saying. It is on the feelings and emotions.
so
So that is
so we'll
important.
change that word called intimidation to amusing. It is a better word to use. Like, oh, very nice. So you've been through IIT
You
Kanpur.
can
What
show
about you?
you can show your intimidation through amusement. That is one way of covering
Yeah.
up that intimidating thing.
Yeah,
It'll also
contact.
help you try to build a different contact with the client, right? It'll help you encourage a better bond by
This is the
amusing
In
last
or
slide.
fact,
channeling
yeah, in
amusement.
fact, yeah, in fact, that's what I feel that suppose you actually tell the client that, oh my God, that sounds really very impressive, but I really have no idea what, this is about. Can you tell me a little bit more? Actually, that's also a very great way to rapport build, because the person
Yeah.
suddenly starts feeling that, see, I've come to this person with my problems, but I can also probably help to educate my counselor on certain other aspects which the counselor doesn't know. In a way, it just works on your
Builds up
psyche.
self-esteem and
So the
confidence.
best
Builds
thing
up
is
on
to be
self-esteem
honest
and
and say
confidence.
that, look, I don't understand what you're talking right now. Whatever Martin you said, it just went above my head. I didn't understand anything that you were, all those technical terms that you were using.
I
But
will
that's
send you
absolutely
the
fine.
text if you
Okay,
want.
can we do one thing? Can we do one thing? There's just about one more slide left. Will you
Oh
finish
yeah,
that and
yeah,
get
sure,
back?
sure. I thought this was the last one. Okay, sure.
No, no, there's
Same here.
just one more. Okay, just one more. Okay. So clients generally like to work with counselors who are considered to be experts, attractive, and trustworthy. Yes, this is to a certain level, I guess. True, because when someone is coming to counseling very like just for the first time, people who are experts, attractive, and trustworthy tend to have a better handle on things. Expertness is the amount to which they are considered as knowledgeable, and attractiveness is the level of similarity between the client and the counselor. So it is not about how the counselor is looking, how beautiful they are, or how handsome they are. It is more about how similar you are, be it in age, be it in your background, be it whatever it is. If you're similar in any way, you tend to attract. So there's this Telugu saying, "Meedi Tenali, Madi Tenali," something like that. All the Telugu people would understand what I'm saying about. So something like that, right? So this can be achieved by speaking in clear. Okay, attractiveness can be achieved in speaking in clear, simple sentences, offering appropriate self-disclosure. Again, self-disclosure cannot cross a boundary into creepy, right? You cannot just give too much information. Trustworthiness is related to the sincerity and consistency of the counselor. This is again important. The counselor must be sincere and very consistent with the client. They cannot just randomly start talking about stuff out of turn and things like that. They have to be extremely sincere. They'll have to wait for their turn, and they'll also have to talk about being consistent about everything they're talking about. Once they cannot support them saying that, okay, you're doing this right, and next day they cannot say that, oh no, the same thing is wrong. That is a lack of consistency. I might have gone a little off board though. Seema?
Yeah, are we done? Like, is this the last
Yeah,
slide?
this is the last slide. After this,
Okay.
it says thank
Okay.
you.
Okay, fine. Let's go to the previous slide. Again, see one thing. I think in the previous this thing also when we talked about communication. See, also it's very important to know the language that the counselee is or the client is comfortable in, because for example, my Telugu is not that good, but if I have a client, I would rather send the client to a person who's very fluent in Telugu, because when you have to paraphrase and summarize and bring out those emotions, it is very important to have a good command over that language. So I would prefer a Hindi and English speaking counselee or a client, and not really any other language. And Kannada, absolutely not, because I don't understand. So what is the point of just pretending to be listening and understanding it and not being able to reproduce it or whatever, paraphrase it? So that is important. And again, coming to a similar kind of client counseling kind of a thing, I don't know, but yeah, I have known of people who are not very comfortable, let's say, with a very young 20-year-old counselor. Very pretty 20-year-old counselor is sitting, and there is a
2 నిమిషాలు
70-year-old
కుదురుగా
gentleman who
కూర్చోలేవా?
walks in. He might feel that, God, will she understand me? But again, it all is the tact and the skill that you use as a counselor, and very quickly the client will get a confidence that, yeah, I think I can share. See, so many times 14-year-old and all come to us, right? In the beginning they may not form that trust immediately. Oh my God, what is this old auntie going to listen to my problems and understand? But then the moment that kid thinks that, ha, she understands, she is able to understand at my level, I can now build that trust and start pouring out. So again, all these things, attractiveness and the other things, it's all about again building that trust and an environment. So I really personally don't think age is a factor. I think anybody can be a good counselor at any age, as long as you give that, you give those vibes, you create that environment where the
Yeah, though you
counseling.
vibe really hard with the client.
Right. So, but if you look at many of the ads which are pouring in now for a counselor job, many of them actually say that required counselor of age 35 and above. They even write it in the ads, because sometimes they feel that, okay, maybe a younger counselor will not have those many experiences in life. Somebody who's just fresh out of college or something, who's a counselor, may not understand. So that is why some of the organizations are particular that it has to be a certain age. But then all that is just at a very, very, surface level. So yeah, and trustworthiness and all these things. So yeah, I think that's it. We can officially close the session and anything else.
Yes,
Seema, you
we
know
can.
what?
I'll
What
stop.
is Seema?
Just
You
a
know
minute,
what?
Martin, just a minute. Shall I
Okay,
stop
closing,
recording or shall I
summarizing,
continue
paraphrasing.
recording? Guys, shall I stop the recording?
Of course.
Yeah. Okay.
Yes, Martin, you were saying something.
So there are cures for like 35